Hello, I am Dr. Stogicza, and today we're going to demonstrate knee cryoablation with a newly developed cryoprobe that has a special 2 cm active tip to provide a strip lesion. So here you can see the cryoprobe. It's a curved cryoprobe that has 2 cm active tip. And the concept is to place it along the femoral shaft and condyle junction to create a nice long strip lesion. The placement will be initially out of plane because that is how you can identify your target area. So we're going to find the femoral shaft and we'll slide distal until we find the junction between the shaft and the condyle, which is marked with blue dots here. Once we have this, we're going to place the probe, of course after local anesthesia, out of plane to touch bone. And then, just to make sure we're really nicely placing it along the bony surface, we'll turn the probe to have an in-plane view, and we're going to slide the probe nicely to touch the bone. And with that, the superomedial nerve would be done. And then we repeat an identical procedure for the inferomedial. Again, touch down on bone out of plane, rotate the probe, and slide in plane to make sure a nice big lesion is placed along the shaft and the condyle junction. And then we will repeat an identical procedure again, identifying the junction of the shaft and the condyle, placing the probe out of plane on bone, rotating the ultrasound probe, and then sliding along the bony surface. This is a 70-year-old female who has arthrosis of both knees, and she tried and failed conservative treatment, medications, and physical therapy. And she's not interested in surgery, but she's also BMI 38, so maybe it is good to avoid surgery. Previously, we did cryoablation on the left knee and also regenerative medicine, and essentially the left knee is problem-free, pain-free, which is better outcome than expected. This treatment is also combined with regenerative medicine, and the concept is to provide short-term good relief with cryoablation and then a longer-lasting relief with regenerative medicine. In her case, it was PRP treatment. Let's review the equipment. So here I'm prepared for a sterile prep and drape. One goes under the patient's leg, one will go on top of the leg. Here is local anesthetic, lidocaine 1%, 10 ml, that should be enough. Here is the cryoprobe, and you can see that this part, the 2 cm active tip, and of course I have a sterile probe cover as well and sterile gel. We are going to start with the inferomedial genicular nerve. So this is towards the feet, and that's towards the head of the patient. Before we're starting the procedure, of course, we're going to test the cryoprobe to make sure that it's freezing. We're going to look. It actually freezes the humidity from the air, but you can also test it with a little bit of lidocaine and see
15 seconds left.
If it's forming an ice ball, and you can see it really does. We're going to identify our first target, the inferomedial genicular nerve. So left is cephalad on the screen. This is the tibia, and by sliding cephalad, I'm identifying the junction of the shaft and the condyle. And I ran out of gel. So here you see there's a bit of a start of a mountain, that's the junction of the shaft and the condyle. And if I scan more cephalad, you can see the meniscus. So I'm going to center on the junction of the shaft and the condyle. You can also see the MCL very nicely, the medial collateral ligament. And I'm going to enter with my hypodermic needle to provide local anesthesia at a nice big distance now, 1 to 2 centimeters away from my probe, and I'm aiming to numb up the center of the screen, which is where I expect the genicular nerves to be. Also make a little bit of a skin whale. And a tiny bit of skin nick so the probe can go through. And it's a bit trickier to manipulate a probe because of the pretty rigid cable. So I might have to reposition a bit. Maybe like this is better. So back on target. And I'm gonna go through the skin, touch down on bone, and you can see I'm touching bone. You can see the movement of the tissue. And I'm going to rotate my probe, and you can see where it's touching. It's touching the tibia. Okay. Now I have a curved needle, and my plan is to lay that curve along the tibial shaft. And it's pretty tricky to lead this, so I'm going to actually go with 2 hands and rotate and advance. And rotate and advance. And let's see the way it looks. You can see the tip. I can advance a tiny bit more to get to the posterior aspect. Again, with full control, 2 hands. And this looks good. Maybe a notch more. Again, if you can't proceed, you turn the probe upwards and then immediately come back and hug the bone. Okay, so here we are in a perfect position, and I'm going to start the first freeze.
Freezing.
You can see, hopefully in a moment, that there's an ice ball or a strip lesion is shaping at the tip of the needle.
1 minute, 15 seconds.
So the hypoechoic is the ice, the hypoechoic structure. Let's turn on color on the ultrasound.
1 minute left.
What you see is always, you see some level of movement. Turn off color. Okay, we didn't see the movement with the color, but you can see the ice ball as I'm following the cryo probe.
30 seconds left.
Here it starts, and I'm tracking it posteriorly. Let's look at it in another view. Again, now you can see essentially 2 big ice balls are covering the periosteum nicely. This lesion is going to go for 90 seconds twice.
Defrosting.
This is the defrosting time, 30 seconds, and then another lesion will follow. So here you can see a nice big ice ball covering the tip of the cryo probe. Here is tibia, ice, tibia, ice, tibia. And once the ice melted, we can remove the probe and move to the next target. I can test if the cryo probe is still engaged, and it is, so I'm not pulling it out yet. Okay, and then we can move to the next target, which is going to be the superomedial genicular nerve. Let's identify the target. I'm going to put my probe somewhere where there is definitely femoral shaft, and I'm going to slide distal until I can identify the femoral condyle, and there it is. Mind you that the patient's leg is externally rotated, so that's why it looks like I'm scanning anteriorly, but I'm not. So here is my target. I'm going to start with the local anesthetic. If you look at the depth, we are at 4 centimeters depth with the target. So I'm going to keep a fairly big distance to be able to nicely lay my probe along the shaft. And you can see that there is intra-articular fluid, so that might alter my program. Okay, so here we go. I slipped laterally from, and now we can go. You can see the tissue moving. I'm going to check one more time for intra-articular, for the suprapatellar recess, if it's in my trajectory. I'm trying to squish the fluid. Okay. So here we go. Let's do a little bit of a skin nick. And then I'm going to advance the cryo probe. Feed it through the skin with lots of control. It's surprisingly harder than placing a local needle. Okay, you can see it, but you can see it, of course, less because we're at the 4 centimeter depth. But you can still see the probe touching down on bone. And now I'm going to feed it anteriorly, or sorry, posteriorly. Now I'm going to put some more local anesthetic because the patient doesn't like this so much. Let's go again. Through the skin. Touching down on bone. It's pretty much going straight down to make sure we don't miss the femur. And I'm going to check my location, and that seems to be correct if you look at the tissue movement. And now I'm going to slide my needle anteriorly to create a strip lesion. Okay. Okay. Here we go. And I'm constantly keeping in touch with us. And this is my first position for freezing. Freeze, please.
Freezing.
Here you can see the needle position is still touching the femur. And if we look at it in a short axis here, you can see the probe. I'm tracking it, and it does indeed arrive to the junction of the shaft and the condyle. So once we're done with the 2 freeze cycles here at the supraromedial genicular nerve, I'm going to remove the probe and go on to the superolateral genicular nerves. In order to save time, I'm going to now put local anesthetic to the lateral aspect of the thigh. For the superolateral genicular nerve, we're going to do the same thing again. Identify femoral shaft. There you go, bright white line. Slide distal until you can identify the junction of the shaft and the condyle, which is pretty obvious in this position. I'm going to center on my target, local anesthetic again. And here we go again with the cryo probe. Feeding through all the way to the femur. I'm going to confirm that I'm at the appropriate location at the junction of the shaft and the condyle. So it is at the junction of the shaft and the condyle. So I'm going to look again in plane and slide posteriorly. You can use the rotation of the probe or the curve of the probe and see how far I got. I can see I can advance a little bit more, maybe a couple of centimeters. And check again. It's pretty much a two-hand job to advance it with control, especially in a bigger thigh. I'm happy with this position, and I'm going to start freezing.
Freezing.
This gives me another chance to identify if my target is good, and it is exactly where I want it to be. Junction of the shaft and
15 seconds left.
Condyle. You can see the ice ball and the probe as well. And again, we're going to do 2 90-second lesions, and with that, the procedure will be complete. So again, here we are doing 2 lesions, 90 seconds twice with 30-second defrost in between. And this gives us time to review possible complications. Of course, infection and bleeding must be mentioned, although if the procedure is done right, there is no major blood vessel here. One needs to remember the saphenous nerve on the medial aspect of the knee. And of course, if we're placing the needle way, way, way too posterior, the tibial and the peroneal must be remembered. With this, the procedure is complete. Once the defrost is done, then you can remove the cryoprobe. The patient can expect post-procedure pain for 2 or 3 days, but most often they already can tell the improvement once they step off the OR table, because they can just move better.